Good afternoon. I'm Donna Jacobs, Senior Vice President at the University of Maryland Medical System. Welcome to all of you today to our lunchtime monthly community conversation series, Let's Talk About Health, where we aim to discuss important health topics in a relatable way. Today, we're talking about Advance Directives, a topic that we know can be difficult for so many to talk about, but a topic that nonetheless is very, very important. We hope that when this webinar concludes, you will understand the purpose of Advance Directives and their value, and you'll be motivated to take action. Leading our discussion today is Deborah Araya. Ms. Araya has extensive experience as a palliative care certified physician assistant at the University of Maryland Charles Regional Medical Center, one of our hospitals in La Plata, Maryland. And it was at Charles Regional where she was instrumental in helping to develop the palliative care program. Ms. Araya holds a master's degree in healthcare management and a graduate degree in clinical hospice and palliative medicine from the University of Maryland Palliative Care Master's Program. And she's presently pursuing her master's degree from that same institution. Because we want this to be a conversation, please feel free, as Ms. Araya is speaking, to share any questions that you may have in the question and answer, the Q&A box. And she'll be happy to address as many questions as time will allow. If we cannot get to all of your questions today, you'll be able to view this webinar, this community conversation at another time, and we'll post the questions and the answers there. And I'll give you more information about that as we go along. Ms. Araya, let's turn to you, please.
Thank you very much, Donna. I'm very happy to be here with everybody today and happy to speak with all of you. First, let's talk about a way to take charge of your own health care by using the Ask Me 3 method. Ask Me 3 is a program that gives you 3 questions, very simple, straightforward questions that you can use when you're talking to a healthcare person, either your doctor, your nurse, pharmacist, anybody in healthcare. And the 3 questions to use are, number 1, what is my main problem? And number 2, what do I need to do about that? And number 3, why is it important to me that I do this? And we'll get back to the Ask Me 3 method towards the end. We'll practice it. So today we're going to talk about living will and durable power of attorney for healthcare. And perhaps this is one of the most important topics that you'll hear this year because it's a very timely topic and very important. Why would I say this? I think if I took a poll of everybody who's listening and I asked you, how many of you know somebody who lost their mother or their grandfather, their sister, their uncle, their cousin, their neighbor, their coworker, their friend during this COVID-19 pandemic, the majority of you would have to raise your hands and say, yes, I did. And that makes this topic very, very timely. So we're going to talk about what an advance directive is. Now in Maryland, the Maryland Advance Directive has 2 components. It has both the living will and the durable power of attorney combined into one form. So going forward, I'll just refer to it as Advance Directive. And we're going to find out what that is, and we're going to talk about why it's important, why does it matter, and then we're going to talk about how to complete one and what happens if I don't complete one. What are the consequences of not doing it? So what is an advance directive? Well, advance means doing something ahead of time, and a directive is to instruct or to show the way. So an advance directive is a document that directs your medical care when you can no longer say what you want as far as treatment goes. Now, it's different than a power of attorney that's financial. And oftentimes when I'm working at palliative care, people will bring a form and say, I'm the power of attorney for my mom. I'm the power of attorney for my loved one. And when you look at the form, it's just a financial power of attorney, which is good that they have that, but it's not medical. They're 2 separate things, and you need both You need the financial, of course, but you need a medical power of attorney that specifically says you're the one speaking for that person. And there's other forms in the state of Maryland that are accepted as advance directives. One example I can think of is the 5 wishes. That would be accepted if it's filled out properly according to the state law. So why are advance directives? Why is it important to direct your care ahead of time? When you think about our society, we don't want to talk about death. We don't want to talk about dying. We don't want to think that we're all mortal. But this year, 542,304 people have died from COVID-19. And with numbers like that, we can no longer ignore death. We have to face it and we have to deal with it because it's all around us with this pandemic going on. COVID-19 passed heart disease and cancer and is now the leading cause of death in this country. Okay, so maybe you're somebody who had just a mild case of COVID and you got through it and now you don't have to worry about all this death stuff, advance directives, any of that. Or maybe you're somebody that got your shots. Yay, get your shots. And so you're not worried about that anymore. There are lots of other reasons to think about filling out your medical decisions in advance. And for example, think about deaths on the road, traffic deaths. I remember driving to work during COVID-19 when everybody was quarantined at home, and it was almost eerie because there weren't many people on the road. So you'd think with lower traffic on the road, our traffic rate would go down, the death rate, the people killed in traffic accidents. But that wasn't the case. In fact, in 2020, the traffic deaths increased by 8%. So they think it's because people were driving faster, I don't know. So death can touch any of us at any time. And this year, I think it touched all of us directly or indirectly. So we need to give instructions ahead of time about our health. It's very important. We don't want to wait till we're incapacitated. We're in a state where we can no longer make our own decisions. We need to think about it now and fill out forms now when we're healthy and we can do that. Maybe we're out enjoying life, fishing, going swimming, hiking, whatever you like to do, and you don't want to think about such things. But in an instant, things can change. People come in with strokes, with cancer, with heart attacks, in a motor vehicle accident. There are many uncertainties in this world. But the one thing that is certain is all of us, at one point or another, at some time, will die. And we need to think about that and prepare and decide ahead. So why do we fill out these directions ahead of time? Why is it important? How often I have seen families who come and their loved one can't make any more decisions. They're in a state they can't decide. And the families, the siblings have to decide. Do you know how hard it is to get 5 children to all agree on one thing? Oh, it is very, very difficult. And not only do they not agree, but they become bitter to one another. They fight with one another. I've seen countless families fight about how their loved one's medical care should be and what they should receive and not receive. So do you want to leave a legacy of love or a legacy of bitterness at the end of your life? By filling out the advance directive, your family will know what your wishes are, what you want, and what's important to you as a person. So giving instructions ahead of time is very important. Giving instructions for your medical care. These directives will allow you the right to decide your own health matters. Somebody else won't decide them for you. They might decide totally opposite of what you would really want. And by deciding for yourself, you're going to take the pressure off of your family. You're going to make it easier for them, and you're going to be the one in the driver's seat, even at the time when you can't speak anymore. You'll have put it into place. Now, I know filling out advance directives is no fun. It's no cakewalk. It's not easy. And I do it with patients all the time. But currently, as Donna had said, I am I'm taking classes at the University of Maryland Palliative Care, and they're excellent classes. I really enjoy them. They're all online, and they're directed by Dr. Lynn McPherson, who's brilliant. And I'm in those classes, and one of my assignments was to fill out an advance directive. Okay, I'm the palliative care physician assistant. I fill out advance directives all the time for people. Piece of cake, right? Wrong. It wasn't easy. It was really difficult for me. I had to face my own mortality. I had to think about, oh, who would I want to speak for me if I can't speak for myself? What do I want to do in these situations? But when I got it all finished, I was so relieved. My husband knew what I wanted, my sister, who I picked second, and my oldest son, who I picked third, they all knew what I wanted, and it was such a relief. Fill them out in advance, and then hopefully you'll feel that relief too, knowing that you got to decide for yourself. You drove the car, not somebody else. Okay, so how do we fill out these forms? How do we do it? First of all, let me tell you a little bit about the Maryland Advance Directive. It comes with 3 parts. The first one is where you get to name who you want to speak for you if you can't speak for yourself, your medical decision maker. The second part is the living will part. So the first part is the durable power of attorney. The second part is the living will part, and this is where you say what treatments you would accept and which ones you don't want in certain circumstances. Part 3 is the signature, and the form is not valid unless the signature part is done properly. So it's very important to do that as instructed. And then there's an optional part about death and burial and different things like that. Now you can fill out just the first part where you name your durable power of attorney and the third part and be done. You can fill out the second part and the third part and be done, or you can fill out part 1, part 2, and the signature part. It just depends on what you want. So who do you pick to make decisions for yourself if you can't make them? You have to find somebody that you really trust and somebody that really knows you very well. You have to pick somebody that will do what you want and what you've expressed, not what they want and what they might think is best for them. It's also important to pick somebody who knows how to make a decision. I had a family member who was the power of attorney not too long ago, and they could not make a decision. They waffled back and forth and just, it was tough. They couldn't do it. So we had to get the whole family in to help them make a decision. So appoint somebody who's not afraid to say, Mom wants this, Dad wants that. And then talk to the person that you pick to make sure that they're willing to do this and to fulfill this role for you. Now, once you've selected your people, your person and your people, then there's a question about when do you want this power to begin? Okay, you have 2 choices in that. You can say, I want this person to start making decisions for me right now, this minute. Or you can say, if and only if I'm not able to make my own decisions, that's when I want this person to start making decisions for me. So most people pick the second one, but there are cases where the first one is more appropriate. There's some people that just don't want to make their own decisions. They want their family member to do it for them. And hopefully they've had conversations with that family member letting them know what they want. And then there's people who maybe they know they have the start of dementia, and before long they're not going to be able to make decisions. So they just want their loved one to go ahead and jump in and start making decisions. So part 2 then is the living will part. And in this part, it talks about what kind of care you want to receive under certain conditions. And there's 3 conditions that are covered that are talked about. The first is terminal illness. The second is a persistent vegetative state. And the third one is an end-stage condition. So the definition of each of these is listed. A terminal illness is an illness when there's no cure. And going to lead to death no matter what you do. You can't preserve life. Death is imminent, and imminent means it's going to happen no matter what. And in those cases, what would you do? The second is a vegetative state, and that's when you lack awareness. You don't know who you are or where you are or who you're with. And this lack of awareness has lasted over a certain time frame and left the person with only reflex activity, but not really any other knowledge of who they are. And then the third condition is an end-stage condition. And this is an advanced condition that worsens with time. It's irreversible, it's severe and permanent, and it causes the person to be fully dependent for their care and unable to make their own decisions. That's the end-stage condition. So in each of those conditions, we have three choices. If you're in a terminal illness, do you want number one, keep me comfortable, allow death to occur naturally? Do you want number two, keep me comfortable, allow that natural death, but if I can't eat, I want to be fed artificially? Or number three, do everything possible to keep me alive? Those are your three options for those three different types of conditions. Now the signature part, and the form is not valid if it's not properly signed. So this is very important. The two witnesses that sign with you when you're making out the form, they have to be sure that you're competent. Be sure that you're able to understand what's going on and to make a decision at this point in time. Somebody who's too far advanced with dementia, they can't fill out this form. They've lost that window. They're past it. So they have to be competent and able to understand what's going on and what they're filling out. And then they have to sign it, and the two witnesses sign with it, that they witness this person signing. And it's important that these two witnesses not be the person making the medical decisions, and also they shouldn't have any financial gain in the death of the person. So shouldn't have any way to profit from that person dying. So what are the consequences then if you decide not to fill out an advance directive, not to say what you want in advance for your medical care? In the state of Maryland, we have a hierarchy that we follow, and that's what we would follow if you don't fill out a form or say who you want. And the first person on the top of the list is a court-appointed guardian. If the person has a court-appointed guardian, they would be the one making the decisions. Next is a spouse or a domestic partner. Following that, if there's no spouse or domestic partner, then it's adult children. And all adult children have equal say. They're all equal. So they have to get along and agree. Next is parents. If parents are still living, they're the next tier. After that is a brother or a sister, and then a friend or a distant relative, somebody like that would be the last choices we would go to. I have had people that had no relatives, and they maybe have a neighbor, and they would pick the neighbor or somebody that they're close to. So if you don't make a decision, this is what happens as far as decision making. And on the pyramid, I want to say one more item. I have seen separated people, a husband and wife that separated, and they've been separated for years, but they weren't divorced and they didn't officially separate. When the wife was ill and couldn't make her own decisions, even though they're separated, that husband still was the legal decision maker. So be careful and make sure you, in advance, say what you want for yourself. Okay? So let's go over the Ask Me 3 method using what we just learned. So the problem, I know that planning is an important way to have a say in my future health care and to prevent unnecessary stress on my family, but I've not completed the Maryland Advance Directive. What is the problem? I've not made my wishes known in a document form through conversation with my family. What do I need to do? Obtain obtain and complete the Maryland Advance Directives with 2 signatures from 2 people who won't benefit from your death once you pass away, and this will make it a valid form. And why is it important for me to do this? This appoints my medical decision maker and allows my family, my physician, and others to know what kind of care I want and do not want if I face a terminal illness, a vegetative state, or an end-stage disease. I put resources on the slides, and the first resource is actually, you can click that and find the Maryland Advance Directive form online, print it out, fill it out, and you're done. Now, some of us are not good with computers. We don't even own one. We don't want anything to do with it. Computers, and that's fine. All you have to do in that case is call the Maryland Attorney General's office. The number is listed there, and you can ask them to mail you a form, and they will put it in the mail and mail it to you, and you can fill it out and take charge of your own health. The second source is just some good information about Maryland Advance Directives. And now we'll take questions and answers, hopefully answers.
Thank you, Deborah. That was really great, and there are a lot of questions. And one of them you just answered, which is, where do I get this form? How do I make it simple? Is it free? And it is free.
It is free.
Yeah, so several people just wanted to know, how do I do this? How do I get started? Do I need a lawyer to do this? So that was great. All right, let me see if I can turn to these questions because they are piling in now. I can get this to move. Okay, one is my brother lives out of state, and there were a couple of people who said, what do you do when you're talking about different state barriers? Maybe I shouldn't be the person to make decisions for somebody who lives out of state, or vice versa, somebody out of state making decisions for me?
It's a little harder if you're a distance away, but sometimes that has to be the case. For myself, I picked my husband, who's obviously right here with me, but my sister lives in South Dakota and my son lives in Minnesota. So I still selected them, and I still would want them to be the ones to make decisions. So even though it's more difficult out of state, it is doable if that's the person that would make the best decisions for you.
Okay, and there were a few people that said, I live alone. You know, where do I keep this document so that people will know? Is there some central place where I can put it?
That is a great question. There are some online places, but the most important thing to do is to give it to your medical doctor, and when you go to the hospital, take it with you, and they can scan it into their system, and they'll have it there too. Make sure that whoever you name on the document has a copy, and anybody else that you can think of that might be involved in your care if you can't speak for yourself any longer. More copies are better. So those are the main places to take it.
Someone asked if we could put the links, and I'm going to ask somebody who's helping us on the tech side to put the links in the chat so people have it today. And everyone, you may not have heard right at the beginning, these slides and this presentation will be available to you in a couple of days, in about 48 hours. And if we don't get to all of these questions, which are popping in, and I'm sure now we won't get to all these questions because so many are coming, we will post the questions and the answers at a little bit of a later time, so you can get all of that information. Someone else said, can I just take my advance directive to the hospital now so it's on file and wait until I'm a patient? And I do think that the answer you just gave about filing it, making sure that your physician knows, is probably better than trying to file it with the hospital. Is that right?
Yeah, usually it's when you are admitted to the hospital that they scan it in. It's kind of hard to get it connected to the patient otherwise, or to the person otherwise, so it's better if, you know, only if you're admitted. But giving it to your doctor, to anybody that is going to be on the form or concerned with the form, and keeping a copy with you so that if you're going to the hospital, you can have it with you. Right.
Okay. It says you have to be a certain age to fill out one of these forms?
You do. You have to be over 18. You have to be an adult.
Okay. I'm having trouble getting to the top of some of the questions. So somebody says, how do I approach an older relative about that? My mother's 90. How do I start this topic, if you have thoughts on that?
sometimes it's
a lot.
hard to start, but you just have to jump in. You have to say, Mom, what would you want in this situation? Can we go through this form and talk about it? Because I want to do what you want. I really care about you, Mom, and I want to do whatever you want in these situations. And then just go over it with them.
Okay. And I've seen this question a couple of times as well. Who determines that you're no longer able to say what you want to have occur? And what are those criteria?
That is an excellent question. And actually, it takes 2 doctors to certify that you are in the terminal condition, the vegetative state, or the advanced condition. So you need 2 doctors certifying that that's the case before these directions will be implemented.
If you know, is there anything that a doctor can do if the family doesn't abide by the advance directive? So I guess in a sense, can the hospital or physician override, if they see the advance directive, the decisions that the family may be expressing?
So in the state of Maryland, the advance directive is a legal form that we are obliged to follow. If the person is in one of those states and they have that advance directive that says what they want, the doctor is obliged to follow the advance directive. The family cannot override it unless they're the decision maker on the advance directive and the person has said, I want you to do what you think is best, and given them the liberty to determine what they want.
There are several questions which talk about the various stages that you mentioned: terminal condition, end stage, vegetative, and some specific questions. So maybe we can talk about a few of those. Okay. Some people ask, if someone is in the hospital with COVID and on a respirator, where do they fall? If someone has Alzheimer's, is that terminal or vegetative? Can you just give us a little bit of the parameters there?
Sure. So COVID-19 has been a tricky one because we didn't know it before this year, and there's so much unknown about COVID-19 even now. There are some people that become terminal because of COVID-19, and there are some people that recover from COVID-19, and knowing the difference is not an easy thing. But there are markers and there are signs and there are things we look for so we can see that the COVID-19 is a terminal condition in that person. And we work very closely with the families, keeping them informed and making sure they know where the person is and what is happening. So COVID-19 is not easy. Alzheimer's was the other question, is that correct?
Yes.
Yes. So Alzheimer's is an end-stage condition. So it falls into the end-stage criteria. Okay. Even though the patient can have Alzheimer's and be vegetative also.
All right, and the information that you gave about the medical directives and the living will were critical, and people are still asking about that. So just one more time, can you explain the medical directive versus the living will?
Okay, so let me get the durable power of attorney. That's where you name who you want, okay? That's my decision maker is my husband. The living will, that's the 3 states and what I want done if I'm in those states. Power of attorney is the umbrella term that goes over the top. In our state, advance directive is the umbrella term that goes over the top. So in our state, it includes both the living will and the power of attorney. So one form has both in the state of Maryland. Does that answer it?
That does answer it, yes. And some of our viewers are really kind of experienced with this and have some very sophisticated questions. And here's one. You'll know this one, and if not, we'll figure it out later. How does the MOLST, MOLST for everyone, MOLST document fit into the Advance Directive, and how important is it to have this form completed?
Okay, I like that question. That's a very good question. I always tell people that the Advance Directive is looking ahead into the future. So it says what you want in the future if you have these certain conditions. The MOLST form, Maryland Orders for Life-Sustaining Treatment, is different. The Advance Directive is a legal paper, it's a legal document. The MOLST form is a medical order. It's filled out by a doctor, a PA, or nurse practitioner. And the MOLST form is for right now, today. It says, what do you want us to do today? If your heart stops, you stop breathing, do you want us to do CPR? Do you want us to intubate? Do you ever want a feeding tube? Would you consider dialysis if your kidneys stop working? But it's asking today, what do you want today? And the MOLST form can be changed. All you do to change the MOLST form is you get a doctor to fill out a new one. And when the new one's filled out, as long as you're competent, you can do that. When the new one's filled out, that's the one that's in effect.
Great, really helpful. And let us put up the screen with the links again while we continue talking, because people are asking about those links and where they can get that form. So that's really helpful. People are still asking about where do I keep this form and how does the hospital know? And the specific question here is, if you're brought into a hospital in one of the 3 states that you spoke of, say you've been in a car accident, how does the hospital know you have an advance directive, if at all?
Yeah, so immediately they wouldn't know if it's not already in the hospital records. But when your loved one or your family are notified, they need a copy to bring to the hospital so they can show what your wishes are. If you're in a vegetative state, there's a time period that has to go by before it's legally a vegetative state. So you have some time to get that form to the hospital to show that what you want and to direct your care.
And I'm sorry for this question. I feel for the person who has asked it, but they've said, I've already been declared stage 4 metastatic breast cancer by 2 doctors. Does this mean my healthcare agents can make decisions now, even though I am fully cognizant? I heard you say you can. It's your choice if you want people to begin making decisions for you now, or if you can say only after A, B, or C occurs. Is that right?
Yes. So there's 2 choices in the Maryland Advance Directive form. The first one is, I want that person to make decisions for me now. If you initial that statement, they'll make it now. But if you say, I only want that person to make decisions if I'm no longer able to make them, you initial that, then they won't make decisions until the point in place when you're no longer able to make your own.
Okay. All right. Those are, unfortunately, okay. Trying to get to these questions, and my computer is not exactly cooperating because there are quite a few here. Okay, people are saying thank you very much for all of your information, that this has been really, really important. So someone says, all right, and this is back to MOLST, if MOLST and advanced directives are different, which is used? And I think you just explained that. MOLST is for today, and you as the patient can make those decisions daily if you choose. Advanced directive is for the future.
That's correct. And oftentimes I'll go in and start going over a MOLST with a patient, and they'll say, oh no, am I dying? And I'll tell them, no, no, no. We go over this with every patient. Every patient should have a MOLST form. And it's something you can change later when you are dying. It doesn't mean you're dying today. It just means you are directing your care today.
You mentioned earlier, very early on, 5 wishes. And someone has said, well, talk to us about the 5 wishes. What does that mean? And is that different than the advanced directive? And if so, how?
Well, at our hospital, we used to use the 5 wishes form for advanced directives. It's an older form that's been around quite a while. You can Google it and find it online. But we don't use that anymore because our state has developed the Maryland Advanced Care Directives that really encompass everything you need and are known and recognized in the state. And I would just use them, the Maryland Advanced Directives.
So you spoke about that pyramid and who has the right to speak on your behalf in what order. And someone has a really good question here. Are children and stepchildren considered equal?
No, the children would have You know what? I'm not certain. I don't want
I,
to fall.
I should have
I have to
prefaced,
say I am not certain on that.
I should have prefaced that by, that's really a legal question, and it's, it's a state and trust law, and so we'll try to get that question. And I'm too long out of law school to remember off the top of my head, but I do think that there is a differentiation.
I think my inclination is to say that the children have first say, that they're the ones that we would look to, and only if there weren't children, and then is the stepchild adopted or not, there's a lot of things you'd have to look at. Are they legally adopted children? And is there anybody else besides them? So there's a lot of issues there you'd have to look into.
There's a comment here that I'm going to read just aloud as I go, and it's from the chair of the Maryland State Anatomy Board. It says, it's the statewide body donation program, and I'd like to point out to the audience that an advance directive to give your body to science on the form is not considered legal donation of your body. In order to be a body donor, an individual needs to complete the informed consent donation forms available on the State Anatomy Board website. We often see confusion and resulting family difficulties when only the advance directive is present. So the point is, the advance directive has some limitations, and if you want to donate your body to science, that's yet another form, and you need to go to the Anatomy Board to get that. Thank you.
Very good point.
Yeah. All right, so someone says that the links are not clickable. That is true, but here they are. And then once again, for everyone, we'll have this up in a couple of days so that you can see it. Let's see. How many people can you have making your final medical decisions?
Well, as a palliative care PA, I prefer that you name a first person and then others to back up. I don't think there's a limit. The form has room for 3 people. It's easier if you name one as the head, because then we know who to call right away. If you name 3, 4 people and they all have numbers, it gets a little harder to know who to call right away. But I don't think there's a limit.
And also, I just want everyone to know that the links are in the chat as well. Okay, sophisticated viewers. So we've already spoken about MOLST, but there's also a form called POLST, P-O-L-S-T. How does that fit in? Does it override the advance directive? Well, tell us what it is first, if you can.
Okay, so MOLST is for Maryland. That's the form that we use here in the state of Maryland. There are other states that use a form called the POLST form. It's a little different than ours, but not that different. But it's for people who live in other states. In our state, we would fill out the MOLST form. And they're the same thing, just different states use different forms, and they're worded a little differently, and they have different options.
So back to the question about, and there are still people asking, I live alone, I don't know what to do with my advance directive, and it sounds like people are motivated to do something about this, which was our hope, and sadly it may largely be due to COVID and what people are experiencing in their families, but if I go to the hospital, can they have this form? So I think the question is there a repository somewhere in the hospital where I know I can deposit this form, or is that just not feasible?
I really don't know that there is, but I would have to check into it and find that answer. Okay,
so we'll look into that, because several people have asked that. And clearly, when you are admitted to a hospital, I shouldn't say clearly, I think this is true, they will ask you if you have an advance directive, and if you don't, would you like to complete one? Which we shouldn't shy away from. I can admit, I myself have said, I know I plan on walking out of here. I don't need to do that, but probably something wise to do. And someone asked, can you direct your care for your pet? I don't know that you can do that in your advance directive. That's something you would do in a will, per se, but you wouldn't do that in advance directive, because the advance directive is about you personally, not the disposition of all of your assets related to your estate or all of those whom you care about.
That would be a financial matter.
Yes, and people have asked, they say, my wife and I have an advance directive already, and the people we've listed are our parents as decision makers. Now that they're older, we're considering changing our decision makers to one or more of our adult age children. And that's fine. People have asked, how do you modify? You just complete a new form, correct?
Correct, that's correct. The latest form is the one we would follow. And just tear the other one up. Or put a line through it and write void.
Okay. All right. Well, I think we're nearing the end of the questions that I see. Let me just check to the end. My father-in-law has a dementia. Can I have him sign a Maryland Advance Directive, or is there a different procedure for people who are already sick? I think you've answered that already, but once more.
Okay. So it depends on how far into his dementia he is. If he's real early and he still understands what he's doing and why he's doing it, then he could fill it out and complete it. If not, if he's already past that state where he can understand, then you would go and become a court-appointed guardian for your father. And that would be through the legal court system.
Someone asked about MOLST. It's M-O-L-S-T. How do we spell that? Or if you're in another state, it could be P-O-L-S-T, and it's all capitals. And people are obviously going to the Attorney General's website already, which is terrific. And someone says it looks like there's a wallet card to carry that's available to you on the Attorney General's webpage, which is great because it answers the question of how does the hospital know if I arrive in one of the 3 states that you mentioned that I may have a form, so you can have one in your wallet, which makes perfect sense.
Very good.
Okay, and then another question was about bringing the form to the hospital, but I think we just answered that, which is really helpful. Let's see, I think I had one more question here. When I turned in my mother's advance directives to the hospital, the change in the level of care was troublesome, and so I'm leery about doing that. But the person who's directed or who is named first as the caretaker can follow along with the care. Is that correct?
Yes, they follow along, and depending on how the person wrote out the form, they can make decisions for the person or, help with the care, yeah. And filling out a MOLST form and saying you don't want CPR doesn't mean you don't get care. You should still get excellent care, all the medical care, with the exception of if your heart stops, you stop breathing, they wouldn't do the CPR. But other than that, you should get full care.
Last question, and we're right at the top at our time. So many hospitals now have electronic medical records or my charts or my portfolio. Can you put your advanced directives into your my portfolio that way? Do you know?
I'm not really that familiar with my portfolio. I know it's really an awesome tool for patients and their families, but I haven't used it and I'm not that familiar with it, so I don't have that answer.
Well, maybe that's a question we can answer for everyone when we go to, when this session is up online and people want to see any additional questions that we didn't get to. All right, well, I want to say thank you so much to you, Deborah. This has been terrific. And there were almost 200 people on this call. So, and people obviously want this information, and I'm glad that we were able to share this dialogue. And once again, everyone, we will have this webinar posted online in about 48 hours at ums.org/letstalk. Again, our conversation is Let's Talk About Health, and so it's ums.org/letstalk. The slides will be available there, and the replay will be available there. And as well, you can look back at any of the other sessions that we've held month to month since June. They're all listed there. And again, we will meet next month, third Wednesday in the month at noon for our upcoming topic, which will be asthma, a big topic for those living here in Maryland. Thank you very much all for joining us today. Deborah, thank you so much for imparting such great information. Have a terrific day, everyone.